So for the assessment, first identify the patient using two identifiers and determine patient's level of consciousness, primary language, and health literacy level. So ma'am, what is your full name and date of birth?
My name is Lian Jensen Garcia and I was born on March 6, 2006.
So what language do you prefer, ma'am?
Ilocano po.
So at tagal ma'am, mag-Ilocano ta. So ma'am, ang among matlaang nga dinunti ayan mo kung ano nga aldaw tatta. So ano adinutaayan mo kung ano nga aldaw at ma'am?
At tayo sa May. Today is May 15, 2025.
Okay. So the patient is oriented and alert. And next, check the EHR for history of lung disease, chest trauma, and vital signs. And assess history of tobacco or marijuana use. So, ma'am, dapat susaro nga tabako or agsigsigarilyo ka ba when mag-verate ka? So, okay. So, if patient had quit, determine length of time since smoking stopped. And if patient vape, determine device type and flavor preference and identify mix of tobacco product used. And ask if patient has experienced persistent cough, sputum production, chest pain, worsening shortness of breath, a hoarse voice, orthopnea, dyspnea during exertion, and activity intolerance, or recurrent bouts of pneumonia or bronchitis. So, ma'am, napadasang banti naguyot iti nabayag like 2 months ka siya. Saan? So, no aguyot ka ma'am adabati plema nga rumrumwar or awan?
Awan.
So, napadasang ban ma'am nga kwa nagsakit iti chest mo ka siya. Anpay, can dapat time nga marigligatan ka nga umangas ma'am? Awan mo't lang. And no agitida ka ba ma'am? Dapat time nga marigatan ka nga umangas?
Awan.
Kat no agik exercise, han ka ba nga marigligatan nga umangas ma'am?
Aman.
Aman. So, okay. And next, determine if patient live or work in environment containing pollutants or requiring exposure to radiation. So, ma'am, di ba pagyaganam or hindi pag-uubram, adu ba ti pollutants or may expose ka ba ti radiation? So, next, review history for known or suspected human immunodeficiency virus or HIV and determine risk factors for TB and ask when patient last had a TB test. So, ma'am, napadasan ba ti nagkaroon ti TB testan? So, next, ask if patient has a history of persistent cough, hemoptysis, unexplained weight loss, fatigue, night sweat, or fever. So, ma'am, napadasan ba ti kwan? Aji no aguyot kakat adati rumwar nga dara. Angkay. Kat aji nutirabi ikat aglingling at kamang. Ken ham ka ba na nagkakaroon ti fever. So okay, and next, determine if patient has a history of hoarseness. So ma'am napadasan ba ti adati puno na pala sa idin tinagkaroon iti hoarseness. So, maantay. And next, ask if patient or assess for allergies to pollen, dust, or other airborne irritants, and to any foods, drugs, chemical substances, and determine if patient has a history of severe allergic reaction. So, mama dapat ti allergy iti tapok, iti makan ngayon, iti agas, or mga chemical substances, gusto ko masabon or detergent. And next, review family history for cancer, TB, allergies, asthma, bronchitis, or emphysema. So, ma'am, hindi ba pamilya nga adabati nagkaroon ti cancer or TB?
Asthma.
Asthma at naman. Okay. And then, assess patient's knowledge, prior experience with chest examination, and risk factors for lung problems and feelings about procedure. So, ma'am, atta ka lang ba nga nagkaroon ti kasto nga examination?
Yes.
So, ang ka nga agdanag, ma'am, i-guide ka iti every nga step nga obraan ka. And for the planning, determine expected outcomes following completion of procedure and explain procedure to the patient. So, ma'am, teobraan tayo na i-assess tayo iti lungs mo. Kan kitaan tayo na adati abnormalities. Kan teobraan lang, ma'am, kan ag-relax ka, kan agamas ka iti normal. And next, anticipate topics to teach patient during examination and perform hand hygiene and prepare necessary supplies at bedside and close room doors or bed curtains and position patient sitting upright. For bedridden patient, elevate head of bed 45 to 90 degree, and when unable to tolerate sitting, use supine or side lying position. So first, let's perform hand hygiene. And all the equipment is here, and the patient is already sitting upright. So for the implementation, remove patient's gown or drapes from the posterior chest and keep front of chest and legs covered. And as examination progress, remove gown from area being examined and explain all steps to the patient and encouraging the patient to relax and breathe normally through mouth. So, ma'am, obraan lang kad nanggap iti amis mo kan ag-relax ka lang kan agamis ka nga komportable. And then for the posterior thorax, first, if possible, stand behind the patient and inspect thorax for symmetry and shape and anteroposterior diameter. So, mamagbalin ba nga tumakter ka kung tumalikod ka? So, as makita iti likod ti patient, awan matlapid di iti any nga abnormalities can symmetrical mod iti likod ti patient. And next, determine rate and rhythm of breathing. Determine rate and rhythm of breathing and examine thorax as a whole and have the patient relax. And next, systematically palpate posterior chest wall, costal spaces, and intercostal spaces. When patient voice pain or tenderness, avoid deep palpation. And when there is a suspicious mass, palpate lightly for shape, size, and qualities of lesion. So, ma'am, mag-break ka ulit sa inyo palpate size and lesion. Ano ba naman natin na sakit na? Okay. So, awan magti inbaga ni patient nga nasakit. And next, assess chest expansion, noting movement and symmetry. Magtakder ka ulit. Agamas ka lang iti nauna. Okay, ngunit sampay. So, kas makita tayo dyan ti chest expansion ti patient, symmetrical mod can equal to movement mo. And next, auscultate breath sounds, listening to entire inspiration and expiration at each stethoscope position. And when sound were faint, ask patient to breathe harder and faster, and compare sound over right and left side, and listen to normal and adventitious sound. So, ma'am, tumakdal ka ulit sa yes. Mapagamas ka. So, it is sound mat nga napad ko kat normal can awan the adventitious sound. But if you auscultate adventitious sound, have the patient cough and listen again with stethoscope to determine if sound cleared with coughing. Next is the lateral thorax, and first instruct the patient to raise arms and inspect chest as same characteristics for posterior chest examination. And so ma'am, mabalik nga ingatong iti, mabalik nga takdal ka ma'am, tas ingatong iti arms mo. And so kas makita na rin iti ayan ti lateral chest iti patient, awan mo ti any abnormalities kaya symmetrical mat isuna. Jibangel. And same mat lang isuna ijibangel. And next, extend palpation and auscultation from posterior thorax to lateral side of chest, except for chest excursion measurement. So, ma'am, mabalik ko mo din nga ito ulit. Iganak lang ang ma'am, okay lang ba kanya? Magamit na kasi. Mapadamis ka. So, normal mat jay sound iti lateral thorax iti patient ket awan iti adventitious sound. So next for the anterior thorax, first inspect the patient's accessory muscle while patient is breathing and no effort to breathe. So the example of accessory muscle we use in breathing, first is the sternocleidomastoid, which is located to the neck, and also the scalens, and the pectoralis major and minor, which is located to the chest, and also the trapezius here at the back. And next, inspect width or spread of costal angles made by costal margins and tip of sternum. Mamagbalin ka nga natin. So, the costal angle is located here, and the costal margins is here in the ribs, and the sternum is located this part. Okay. And next, observe patient's breathing pattern and observing symmetry and degree of chest wall and abdominal movement. Palpate anterior thoracic muscle and the ribs for lumps, masses, tenderness, or uneven movement following a systematic pattern across and down. So, ma'am, mabalik ko na sobat ko kadi nga igdanan. No, mapalpate ko na sa yahat. Anterior thoracic muscle. Ano ba ang mga advocacy? And palpate chest excursion, noting symmetry. So, mamabali nga magtakdal ka. Tapos agamis ka lang mamagamis ka lang. So, okay mat, iti chest excursion the patient and symmetrical mat isun. And next, with patient sitting, mamabalin ka ang tugawan. With patient sitting, auscultate anterior thoracic and compare right and left side. So the sounds were normal and there is no adventitious sound. And next, clear and store stethoscope and proceed to next examination or help patient to a comfortable position. And perform hand hygiene. And place nurse call system in an accessible location within patient reach and raise side rails as appropriate and lower bed to lowest position locking in 2 position. For the evaluation, compare respiratory findings to normal assessment characteristics or previous assessment for thorax and lung, and how patient identify own risk factors or those factors leading to lung disease, and use teach back, revise instruction if patient or family caregiver is not able to teach back correctly. And for the documentation, document respiratory rate and characteristics, breath sounds, and changes noted after coughing, chest excursion, and other physical assessment findings, and also document evaluation of patient, and also document evaluation of patient or family caregiver learning. And for the hand-off reporting, report abnormalities immediately to the healthcare provider.